Trigeminal neuralgia, tic douloureux, TIC tic douloureux, DOULOUREUX, tic douloureux. Trigeminal neuralgia or tic douloureux is an intensively painful neurologic condition that affects one or more branches of the fifth cranial trigeminal nerve. Patients experience sudden paroxysms of lancinating or electric shock like facial pain localized to one or more branches of the nerve. The pain is often precipitated by trigger points that fire when the patient talks, shaves, eats, touches the face, brushes the teeth, or is exposed to cold wind. Trigeminal nerve branches. V1. Ophthalmic branch. Pain involves the eye and forehead. 2. Maxillary branch. Pain involves the cheek, upper teeth, upper gums and nose. And third one, mandibular branch. Pain involves the lower jaw, side of tongue, lower teeth, lower gum, extends to ear. Pathophysiology and etiology. Unknown cause, degenerative or viral causes suspected. Compression from artery adjacent to the nerve strips myelin from nerve when it pulsates. Loss of myelin acts like an uninsulated wire that fires abnormally in response to stimuli. Trigeminal neuralgia is often seen in the elderly population. Pain often appears to be localized to one or more teeth. Patients may seek dental care for pain relief, resulting in one or more tooth extractions without alleviation of pain. Clinical manifestations. Sudden severe episodes of intense facial pain localized to one or more of the branches of the nerve, lasting less than 30 to 60 seconds and ending abruptly. Pain is precipitated by activation of trigger points such as touching the face, talking, chewing, yawning, and brushing the teeth that place pressure on the terminal end of the branch affected. Pain is always unilateral and does not cross the midline. Bilateral pain is sometimes seen in patients with multiple sclerosis. Some patients experience numbness, particularly around corner of the mouth. Diagnostic evaluation, history of characteristic symptoms and pattern, CT, MRI, skull X-rays to rule out other disorders. Initial response to pharmacologic treatment is the majority of cases. Assessment. The nurse should take the history of the pain, including duration, severity and aggravating factors. Assess nutritional status and hydration. Assess for anxiety and depression, including problem with sleep, social interaction, coping ability. Management. Pharmacologic management. Use of carbamazine. Tegretol is the first and most effective medication used to treat condition. Other drugs such as imipramine, phenytoin, baclofen, Divalprox, Divalproex, Divalproex, gabapentin, that is neurontoin, may be added to or substituted over time. Although pain generally responds to pharmacologic intervention, it gradually becomes refractory over time or patients suffer undesirable side effects. Surgical alcohol and phenol block for pain may last several months after injection. Percutaneous radio frequency trigeminal gangliolysis, low voltage stimulation of nerve by electrode inserted through foramen ovale. Sensory function destroyed but attempt to preserve motor function. May cause decreased corneal sensation if V1 is affected. Paresthesias, jaw weakness, undesirable, painful numbness, that is anesthesia dolorosa. Pain may occur as nerve regenerates, necessitating repeat procedure. Anesthesia dolorosa, DOLOROSA. that is painful numbness. Rhizotomy, transection of nerve root at Gasserian ganglion. Rhizotomy causes complete loss of sensation. Other complications include burning, stinging, discomfort in and around eye, herpetic lesions of face, keratitis, and corneal ulceration. Microvascular decompression of trigeminal nerve. Intracranial procedure. It is an intracranial procedure, most effective form of therapy with 75 to 80% of patients pain-free without need for medication long term after the procedure. Treatment of choice for younger patients willing to accept craniotomy. Complications: anorexia, weight loss, dehydration, anxiety, fear, depression, social isolation, suicidal ideations in extreme cases. Nursing diagnosis: pain related to psychological changes of the disorder, altered nutrition, anxiety and depression. So the interventions will be mainly focused on relieving pain, maintaining adequate nutrition, reducing anxiety. Outcome based evaluation: patient verbalizes reduced pain, weight maintained, and patient verbalizes decreased anxiety and depression. Thank you.